Hello, I am Dr. Deepak Goenka here from Institute of Human Reproduction, Gauhati, also popularly known as Goenka Nursing Home. Let us discuss a little bit about can we prevent infertility. Today, all of us are seeing the incidence of infertility is rising. I am sure all of us are knowing someone who is suffering from infertility and is struggling with the treatment. But is it possible to prevent this struggle? Yes, to some extent it is possible. Why are we seeing this rise in infertility? Basically, we ourselves has to be blamed. One of the most important cause of this rising infertility is our changing society. Today, what we are seeing 50 years back, average age of marriage was 20 years for a girl. Today it is somewhere around 26 to 27 even in India. Earlier the women education was not so much common. Today all our society, because of the changes in our society, all our schools and all our colleges and all our universities are seeing a good number of uh, girl population going for the higher educations, which is good. But we must also understand, as the age increases, the quality and the quantity of the eggs in every girl also decreases. It is best to complete their family when before the age of 32 years. So this is a very important carry home message. Every girl should complete whenever possible their family before the age of 32 years. But many times it is not possible. Then we have another option of oocyte cryopreservation or embryo cryopreservation. Definitely this is not the best, but it is a valid option which many of the multinationals are also offering to their employees. If you are today you are busy with your career building and not ready for the parenthood, you can go ahead with the cryopreservation of the embryos if you are married, or you can go ahead with the cryopreservation of the oocytes or eggs if you are unmarried. Another reason for the rising infertility is our lifestyle. Today, India is capital of obesity. We see maximum number of the patients with obesity and its complication in India. And infertility is also one of the complications of the obesity. Obesity in Western countries, it is defined as once the BMI is more than 25. But for we Indian population, we are different. Our genetic makeup is different. We see these problems once our BMI is more than 22. So let's not stay in denial if our BMI is 24, I am not obese. No. In India, if your BMI is more than 22, you are in the category of obesity. And it is very important to understand, once you are obese, the quality of the eggs and the quality of the sperm both decreases. It increases the chances of failure of infertility treatment. Your expenses will increase for the treatment, and the duration of treatment also will increase, resulting into more frustration and more financial involvement. Another thing with what we can do is to avoid all this stuff, addictions which we are seeing nowadays more and more in the society. Addiction with alcohol, addiction with tobacco. Both the things decreases the quality and quantity of sperms and the eggs. So lately I saw few patients which were very sure there is absolutely no addiction. They don't take of any form of cigarette, no tobacco, no alcohol. Digging little bit more and we realize they are doing hookah or electronic cigarettes. These two carries tobaccos. So let's not stay in denial. All these things does affect the chances of pregnancy and should be avoided. What next? Can we do something more? Sex education is also very important. Today, even in 2023, whenever we talk about the sex education, most of the parents shy about it to talk about it with their kids or children. but it is very important to explain them. Let's again not stay in denial. In a recent survey in Mumbai, it has been seen that 60% of the teenagers are involved in some sort of sexual activity. So, and this is true for all classes of family, whether it is a lower class, middle class or upper class. We have seen young girls as young as studying in class 9 coming for sexual advices. So let's not stay in denial. We have to talk to them, we have to explain them. Avoiding multiple sexual partners, taking proper precautions, avoiding sexual activity before a certain age limit is advisable, and this type of sex education is important to understand that these will prevent sexual transmitted diseases or injuries which can lead to infertility in future. Coming to the another important aspect of prevention of infertility, nowadays we have more and more options. Whenever a patient has to go for the surgery, we should always offer them fertility preserving surgery. We can go ahead with the conservative surgery. If there is a cyst, we can think of removing only the cyst, and the mode of surgery is also important. Earlier we used to talk about opening the abdomen, that what we call is laparotomy, but now all the surgeries can be performed with laparoscopy. All the gynecological disorders can be tackled laparoscopically. The only thing is required a little bit of skill from the surgeon side and little bit of trust from the patient side. So laparoscopy surgeries are much better than laparotomies or opening the abdomen, and which decreases the chances of infertility in future. There are so many more things we can talk about prevention of infertility, but because of the paucity of the time, I am finishing it here. All of you are most welcome to discuss these issues with any of one of us here at IHR Guwahati. Thank you.